Hello, everyone, and welcome to today's case study, which will be revolving around John Snow and his contributions to epidemiology. In today's episode, we will be discussing four main questions. The first being, what does our selected case study topic have to do with the application of epidemiology today? How we're handling similar situations differently today? How this event that we have picked impacts today's society? And what are the implications for public health and our clinical practices which are currently in place regarding our case study? Before diving into questions and answers, just a fun way to present all of this information, each teammate has taken on a role, as it is well known that epidemiology has many different career paths along with public health as well, so each teammate has picked a different career path and they will be playing their role accordingly. The moderator will be played by Elisa, the epidemiologist will be played by Tuerrelle, the public health historian will be played by Caneeya, the public health practitioner will be played by Megha, and the social impact analysis will be played by Harmohit.
John Snow's investigation showcased the fundamental principles of mapping cases, identifying sources of infection, and unraveling the complex web of disease transmission. Fast forward to today, where epidemiologists stand on the shoulders of Snow's pioneering work, employing advanced technology and statistical methods to study and control infectious disease. Snow's emphasis on clean potable water echoes through time. Modern cholera prevention relies on maintaining a pure water supply through treatment and emphasizing proper human waste management. But Snow's legacy isn't confined to water purity. His insights into disease transmission resonate, especially in the aftermath of the 2010 earthquake in Haiti, sparking a cholera outbreak that affected nearly 700,000 lives. Two theories emerged, one suggesting seismic displacement triggered the evolution of a non-pathogenic strain of cholera into a pathogenic strain. However, contact tracing and genome sequencing uncovered a different truth. The disease wasn't a product of nature, but a consequence of human actions. United Nations troops, unknowingly carrying cholera from Nepal, revealed the interconnectedness of global health. As we navigate the complexities of modern epidemiology, John Snow's legacy remains a guiding light. His principles etched in the pages of history continue to shape our efforts in preventing and understanding infectious diseases.
While Snow's work helped to lay the groundwork, today's approaches to cholera outbreaks and similar situations are more sophisticated. Rapid response teams, advanced laboratory diagnostics, and evidence-informed interventions characterize strategies used. Modern technologies and real-time data analysis also help to allow for quicker and more targeted responses compared to the methods which were used and available in the 19th century. To help gain a better perspective on how Snow helped to create better methods for handling similar situations in today's world, it is important to look into the historical context and how that has impacted the field of epidemiology today. The first element to observe would be the theory of how bacteria spread back in the 1800s. The miasma theory attributed diseases like cholera to quote-unquote bad air. Snow challenged this, linking cholera cases to contaminated waters rather than quote-unquote bad air. In comparison to the miasma theory, in today's world, the germ theory of disease is used. These two popular theories, from their respective time periods, help to show the evolution of thinking within the scientific community, along with the progression of better understanding diseases and how we can limit their spread. Today, epidemiologists consider the human and physical environment's role involved in tracking cases, monitoring global threats, and informing the public. One of the biggest examples which can be used today would be the COVID-19 pandemic. Many epidemiologists and public health care workers use various means of data ranging from patient zero, contamination sites, modes of transmission, and much more to understand how the virus was being spread and how the public could be protected. The contrast in theories and practices from both the 1800s and now reflects significant progress in public health. Evidence-based approaches and technological advances have transformed our ability to respond to not only cholera outbreaks but other disease outbreaks on smaller scales and global scales.
John Snow's impact extends globally. His work catalyzed advancements in public health infrastructures, water sanitation systems, and improved hygiene practices, and a focus on disease prevention are direct results. The emphasis on understanding the social detriments of health advocated by Snow has influenced public health policies worldwide, including in Canada. While there are many influential individuals who helped to pave and shape the ways of modern day epidemiology, John Snow can be considered one of the most notable. His contribution to the world of epidemiology has impacted public health not only in Canada but globally. John Snow looked at cases as more than just a patient but in the environment they are surrounded in, which led him to his creation of his Chloria map. His advocacy for his community has helped him form the world of public health and epidemiology. Modern day identification of bacterium, pathogens, and viruses are also more well known. Another large impact Snow made was the idea of disease transmission and moving away from the Misasa theory. This helped newer generations of epidemiologists and other public health workers to expand their ideas as to how bacteria actually spread.
The John Snow and cholera study has lasting effects on the public health and clinical practice. Even though there have been a lot of changes in the science and technology since the 19th century, the principles are still applicable. The implications are like John and Snow focused on collecting data and mapping, which is the base of epidemiology in public health today. With that in present, the public health professional used statistical techniques and visualization tools to tackle the outbreaks. Moreover, they introduced the term as water and sanitation policies for the transmission of cholera. Public health is working even that on in the 20th century to have a policies so people can have access to clean water and sanitation in order to avoid and prevent any waterborne diseases which include cholera. Public health and clinical practices are working on the marks that were established in the 18th century connecting to John Snow cholera by using strategies for the outbreak response. Removing the water pump handle was a strategy for the outbreak response by John Snow, and in the present, assembling the outbreak committee, testing in the laboratory, performing clinical practices, updating local authorities are the implementing strategies which are related to the containment. These are the steps that are taken. For example, during the outbreak of COVID-19, strategies like quarantining, social isolation, and screening methods were successful strategies for controlling COVID-19, which represents the importance of strategies. John Snow's work also shows how important public health is, as how important the public health education is in the present time. People are educated, and education about public health is also going on to teach how to have safe and healthy community, knowing social determinant of health, which is also an implication of public health and clinical practices.
With all the information presented, it is known that John Snow is a well-known individual within the epidemiological and public health field due to his contributions. While he may not have had all of the resources and research that we do, he helped to pave the road that we now walk along. From the use of advanced technologies along with the evolution of disease transmission theories, we are more equipped and educated on keeping people safer, not just from cholera, but many other diseases on small and global scales.
Thank you
Thank
for
you
watching.
for watching.